am delighted to welcome you to the CEG-led programme on addressing falling rates of preschool immunisations in London. Can I just say that we'll be recording this event for people who can't attend, and that the slides and the recording will be shared by email and will also be available on our website. And that if you could kindly keep your cameras and your microphones off until you're speaking, unless you're a speaker, and that we've got a really busy agenda over the next hour. We've got 5 people each talking for about 5 minutes. And then in order to make this work, we're going to have questions at the end. So the questions will be done through the chat, and you can put your questions in the chat, and then we can try and take those at the end. But we've only got 15 minutes, so some of those we may remit to, kind of a further discussion, with the individuals concerned. So really, I'm delighted to announce this programme, and it comes at a time of crisis in childhood immunisations, and I think you'll hear about how dire the situation has got, and the extreme likelihood of a measles outbreak over the next kind of period until things improve. This has been made possible, this programme. It's a Pathfinder programme as part of the London Health Data Strategy, which aims to integrate health data across London more widely. And so it's an important programme in the sense that it extends CEG's remit not only to North East London, but to London more widely, which is for us an important element. So I'm going to not speak for any longer and to ask Helen Bedford, who's our first speaker, who's Professor of Children's Health at UCL Great Ormond Street Institute of Child Health, to take us off on the national view and context for this programme. Helen, over to you.
Thanks very much, John. I'm delighted to be here. Now, I don't need to emphasise the importance of vaccination for population health. It prevents illness, disability and saves lives. But the success of immunisation relies on having high vaccine coverage and timely vaccination. And these depend on having systems which call and recall and remind parents. And reminder and recall programmes have been shown to increase vaccine uptake by up to 20%. But to be able to do this, you need to have good systems to be able to identify children who are eligible for vaccination. And these systems are the engine that drive the vaccination programme. So first, I want to give you a quick overview of where we are now with vaccine uptake in England. So shown here, these are annual data for 2020-21, and these are from NHS Digital. And I've got a few things coming in, so if you could press the slide to advance it, please. So 92% of 12-month-old children in England have completed their primary course of vaccines. So that's 3 doses of the 6-in-1 vaccine that you can see at the top there. This is pretty good, but we could do with an improved rate. What brings that average down is London. And the issue of concern is the wide variation between local authorities, with the lowest uptake in England in City and Hackney, which is 30% lower than the highest local authority in the country, which is South Tyneside. Uptake in London is 86.7%. Could you move the slide on, please? And here are figures for 24 months. So by this time, there is a slight improvement, but we still see a similar large range. Next slide, please. So these are annual uptake figures for MMR vaccine. Now, just a reminder that to develop population, or as it's sometimes called, herd immunity, we need a sustained uptake of 95% uptake of 2 doses of MMR vaccine. This is because measles in particular is so highly infectious. So the reproduction number, the R number that we've heard a lot about with respect to COVID for measles is about 15 to 18. So that's how many susceptible people one infected person can infect on average. in contrast, the R number of COVID is about between 1 and 2. So again, at 24 months in England, we can see this large range in uptake. In London, uptake is 82.4%. Almost 1/3 of 2-year-olds in City and Hackney have not had their first MMR, and in Camden, it's about 1/4 of 2-year-olds who remain unprotected. By 5 years of age, in London, 1/4 of 5-year-olds have not had 2 doses of MMR. Next slide, please. So this slide just highlights London data. Again, this is annual data from NHS Digital, where we can see clearly that of the local authorities, none reach 95% uptake for either the primary course on the left or the first dose of MMR on the right. And indeed, only Sutton and Bromley achieve over 90% for MMR uptake, and both these are literally just over 90%. Next slide, please. So this highlights the current concern. These are quarterly data, the most recent quarterly data for July and September. And what we can see that in England and London, there's been a small decline in uptake in the most recent quarter compared with the previous quarter and the previous quarter. Now, we can discuss the reasons for this, but I would just like to bang on the head here that this is probably not due to anti-vaccine sentiment as people have painted it. There is very little evidence for that. Other factors, such as pressure on GP services, reductions in health visitor numbers, are much more likely. And research has shown that parents haven't been wanting to put pressure on the NHS or are worrying about the risk of infection have stayed away. Also, that they weren't aware that vaccine services were available, and this is much more likely to be the main cause. But we do have an awful lot of catch up to do. The other issue, of course, is there's been very little disease around. We've only had 2 confirmed cases of measles since early 2020. And of course, the absence of disease may give people false reassurance that vaccination is not necessary. Next slide, please. So finally, in a minute, just to let you know that NICE has been developing guidance on vaccine uptake in the general population, and the consultation period has just ended. And this is going to replace previous guidance published in 2009, but that only covered up to the age of 19. This guidance covers vaccine uptake for anyone who's eligible for vaccines, apart from flu, which has got its own guidance. And just shown here, I won't go into great detail because the link is there so you can go and have a look at it. But this is just an example. NICE has produced a visual summary on identifying people eligible for vaccination and opportunistic vaccination. And this is due for publication in May. Thank you very much.
Helen, thanks so much indeed. So I'm going to race on to our next speaker, which is Carol Dezateux. She's the Professor of Clinical Epidemiology and Health Data Science and is a clinical lead for the Clinical Effectiveness Group at Queen Mary. Carol.
Thanks very much, John, and thanks, Helen, for that really fantastic introduction. Next slide, please, Milena. So in my 5-minute slot, I want to introduce and outline to you the key elements of CHIME, which is our London Pathfinder project to improve timeliness and equity of routine preschool childhood immunisations. And this is a collaboration with colleagues in South East London, North West London, and parent public involvement member Nawe Moss, and is the product of considerable work by this stellar project team listed here. Next slide, please. So what does CHIME aim to do? Well, we aim to improve timeliness and equitable delivery of the routine preschool childhood immunisations using best evidence for data-enabled quality improvement programmes in primary care. And you've heard from Helen that call and recall tools have a great track record in this regard. But why are timeliness and equity important? Well, children who are not protected against measles and other infections on time have a higher chance of infection, and this in turn increases the risks of community outbreaks of measles and other infections in London. And in fact, we had one such outbreak in 2018. And this is particularly a risk for children from poorer neighbourhoods and from certain ethnic groups who are less likely to be protected on time or at all. So how will we do this? How will we respond to this huge challenge? We've produced a set of in-practice tools to help practices navigate what is actually quite a complex immunisation schedule consisting of 17 different vaccines on 9 different occasions in the first 4 years of life. We've released these tools in North East London this month, and the South East and North West regions will follow over the summer. And we're also producing maps and dashboards which will help practices and commissioners understand how well we're doing in real time, and we'll be evaluating the programme and disseminating our experience and our learning more widely. And all of this is working in close partnership with parents, health professionals and key stakeholders, because we want this programme, this 12-month programme, to be sustained beyond the end of this year. So in the next 2 slides, I'll tell you a little bit more about the in-practice tools. Next slide, please. So CHIME is an integrated programme for primary care, and at its heart are these data-enabled tools, which are really designed to help practice teams work smarter, quicker and better to get children immunised on time. And they leverage 2 sources of data. The top one are the patient record systems, EMIS and System 1, used by practice teams. And shown on the right is the first of the tools, a data entry template, which helps practice staff record information accurately at the point of care. And the second tool is shown in pink here, which is our call and recall tool. And that helps practice managers and staff prioritise their workload efficiently and ensure that no child is missed. So what does a call and recall tool do, and how does it work? Next slide, please. Our call and recall tool is an active patient link tool which CEG has used successfully in other quality improvement programs. As I said, it helps managers and nurses to prioritise appointments by listing all children who are due or overdue their immunisation each week, with options to filter the list by type of vaccine and age of the child. And it also creates a SIMS or text-ready file for messaging parents, either with an appointment or a reminder for the appointment or other information. Staff can also, without leaving the tool, undertake a virtual patient review to tailor the approach to individuals, and they can see at a glance all relevant immunisation records for that individual child in one place, and that includes dates given, contraindications and any record of declined vaccination. And it includes live links to information on vaccine schedules and guidelines, and to support conversations with parents. And that particularly will be useful as the new NICE guidelines that Helen has just outlined emerged. Next slide. But there are many components which are essential to the success of quality improvement programs. So data-enabled tools on their own don't work unless we provide training, education, resources and facilitation, which is actually the clinical effectiveness model. And you can see here the vital supporting elements listed, and very importantly on the right, the facilitators. I'll just flag to you that the CEG YouTube site has 5 demonstration videos which take users of our call and recall tool step by step through how to do this. So we released this call and recall tool about 1 month ago. And as of yesterday, half of all North East London practices had downloaded the tool to use, and around 1/5 of them had already booked visits with our great facilitation team. So we're off to a good start. So thinking now, where are we now with our timeliness in North East London, and where do we need to be? And I think Helen has shown you coverage data, but in fact, there are no national data on timeliness. So we have analysed data from the Discovery Data Service for North East London to get a picture of our baseline. Next slide, please, Milena. This figure shows on the vertical axis the percentage of children in North East London receiving a first MMR dose between 12 and 18 months of age. And on the horizontal axis, monthly data from September 2020 to January 2022. The red line is unfortunately where we are with timeliness, and the green band is where we would like to be to protect children fully according to the WHO and the Quality and Outcomes Framework thresholds shown. This 15 to 20 percentage point gap illustrates why we need this programme now. And we won't close this gap overnight. So in addition, we're working with commissioners in North East London to find additional ways to support and incentivise our hardworking London primary care teams to succeed. Next slide, please. So just to finish by acknowledging the funding and support we've received through the London Data Pathfinder from One London and HDR UK. But this builds on work that we had already started with the generous support of Bart's Charity and also the North East London Digital First programme. And we're grateful to our funders. And again, I'd just like to acknowledge our collaborators and project team, and we'll take questions at the end. Thank you, John.
Thanks very much, Carol. So that segues really nicely into our next speaker, which is Kath Evans, who's the clinical lead for babies, children and young people in East London. Kath.
Thanks ever so much, John. And I just want to pause for a moment and say huge congratulations for this phenomenal work. And I just wanted to reflect on where it potentially sits as we go forward. I think it's an incredibly exciting time for child health after many years of lobbying by organisations such as the Royal College of Paediatrics and Child Health. We finally have a national babies, children and young people transformation programme chaired by Sarah Jane Marsh, our Chief Executive of Birmingham Women and Children's Hospital, along with Ruth May, our Chief Nurse at NHS England. And it very much builds on the National Maternity Transformation Programme, Better Births. So we're now beginning to see real national leadership that's required to create better childhoods by focusing on improved child health outcomes so that every child is supported to flourish, thrive and, importantly, reach their potential. Within NHS England London region, we have our Babies, Children and Young People Transformation Programme chaired by our Regional Medical Director and paediatrician, Dr. Vin Dwarka. And this brings together the 5 emerging integrated care systems of the capital to learn from each other and vitally work in partnership with the GLA and wider partners. And I can see that Dr. Manda Watson, our clinical lead in North West London, is also on the call this afternoon. Each of our integrated care systems is charged to have a babies, children and young people transformation programme. And here in North East London, we not only have an emerging programme, but a vibrant community of people who are passionate about improving child health outcomes. So the North East London programme brings together our local authority colleagues in each of our boroughs, picking up public health representation, education and social care, our community services, mental health services, primary care, secondary and tertiary care, along with voluntary sector colleagues. Together, we are focusing on 3 critical elements: advocacy for and with this population group, a commitment to relentless focus on delivery of consistently high quality services, and a real desire to transform services addressing contemporary challenges, as we've seen addressed this afternoon. Importantly, our programme is about working with babies, children, young people and their families so that we keep focused on what matters most to them. Within our North East London ICS, it's very much supported by the executive team. So we've got Dr. Jagan John, our clinical chair, who you're going to hear from shortly, Simon Hall, our Director of Transformation, as our SRO for our programme, and Diane Jones, our Chief Nurse. And we've got 6 key priorities: building community capacity, strengthening our offer for our children with special educational needs and disabilities, building our outcomes framework, and strengthening our pathways for our children with long-term conditions, asthma, diabetes and epilepsy initially. And also thinking about connectivity with other programmes, for example, the recovery work that's underway with regard to babies, children and young people, along with targeted groups for our focus on children who have got learning disabilities, and thinking about our children who are care experienced to break those cycles of inequalities. So the immunisation work led by the QMUL team is absolutely embedded in many of our priorities that I've outlined. Importantly, it's within strengthening our community capacity, and it's also connected to our focus on workforce development. As Helen identified, health visiting numbers are a significant challenge for us, and it's absolutely something that we're focusing on. Ensuring professionals have capacity to connect and ensure that they're able to engage in promoting immunisation programmes is absolutely essential, along with utilising digital tools as well as face-to-face connections. I'm just very aware of our digital Baby Buddy app that was launched last week promoting immunisations, our e-Red book, along with digital access to Healthy Start vouchers. These are all opportunities for conversations as we go forward. So the immunisation work is very much within the Child Health Programme in North East London, and we're absolutely committed to working in collaboration as we go forward. And just to reiterate my sincere thanks for all of the work that the team have done to date. Thank you, John.
Thanks so much, Kath. So I think that kind of gives us that wider context in which this is placed. And that's really helpful. Our next speaker is Jagan John, who is the chair of North East London CCG. Jagan.
Thank you, John, and thank you to all the speakers. I mean, fantastic presentation, and I also want to thank Kath Evans, who has been really championing our children's and young people's programme. But it is unfortunately a really difficult time for us as a ICES and CCG. We do have significant variation, and you saw some of the speakers talking about it just within North East London, some of the issues with uptakes and some of the problems that we've had, and our frontline primary care teams have been talking about these mobile populations, the ethnic variation and the disadvantaged groups, and the uptake has been quite poor. And unfortunately, we've seen some decrease during the pandemic. But what this does give us the opportunity through the fantastic work through the CHIME programme as well as through the CEG work is providing that timely information, getting accurate database according to where our children are with their immunisation, and having that tailored approach that informs not only our practices but our primary care networks to really try and address this program. And it isn't easy. It is a difficult thing. If you hear from our frontline teams how difficult it is, multiple DNAs not necessarily always coming for those appointments, and for us to really go back to the drawing board. And I think this tool, this APL-Imms tool, is very helpful for us in general practice and our teams by giving us the opportunity to really think about immunisation in the widest context and working with our partners, that may be public health, i.e. with our messaging in those local borough partnerships, working with other practices, working with the workforce in a very different way to see how we can address the uptake and improve the uptake. And we have seen programs across North East London where people have done things that are slightly different to improve this, you know, working at different times, working with faith groups, or working with all sorts of voluntary sector organisations to improve the uptake. So this is very much not only primary care leading this in terms of, you know, addressing this, and we've seen primary care doing multiple immunisations over many years, and we've demonstrated that primary care is really effective in this, but actually working with all our partners on a very small geography in that place-based approach and population health to try and address some of the concerns that people have. And I love the tool, the fact that you have so much information for those, and those videos, and those having that information to address some of the, I would suggest that some of the kind of concerns that some of our parents have with this going forward. But certainly for me in primary care, the tools that we have, allowing staff to be always educated, as you know, we have a workforce that is diminished in some parts. We have a workforce that's always changing, and having that constant reminder, that constant information for practice staff to get the important, not only to understand the importance, but also understanding how we can use this tool as effectively as possible. And what we have done is also looking at a consistent approach across our 7 boroughs to say, let's look at the information as a wider system, because we've all had slightly different ways of approaching and sharing best practice, and those practices that have a really great uptake, what are they doing differently with the data? How are they addressing this? What have they? And that's the benefit of working in an integrated care system and primary care system as a whole, and using that tools, we can share the best practice and learning going forward. And I think for me, I applaud this program and be very supportive of this program, because what we are learning is not only trying to improve our youngest residents, the uptake, and as well as trying to combat any outbreaks that we might have, but also it's also thinking about how we sustain this for the future, and which is why this work is really, really important to North East London. Is how do we support our frontline teams? How do we support that data set, and how we can improve it? And that's what's exciting about this population health approach, as well as also looking at a very much a frontline approach. So I just want to say thank you very much to the team. It's a fantastic. We have a real asset in North East London by having this team here and providing us innovative solutions going forward. And thank you very much. Over to you, John. Thank you.
Thanks, Jagan. That's very helpful. Could you go on to? Oh, that's great. So our next speaker is Luke Readman. Luke has been working in East London for some time now and has progressed to become Regional Director of Digital Transformation in London for NHS England. So Luke, give us a broader view then on Pathfinder projects and the One London strategy. Thanks.
John, thanks very much for that introduction, and it's great to be back in East London amongst the people I sort of grew up in this world in. So I'm grateful for that, and the ability to keep working with you is really valuable to me. If you can just go to the first slide, please. So this project was selected along with 3 other projects to support through what we're calling the London Health Data Strategy work, and we class this as a Pathfinder project. What we intend that to do is take the learning from this project and apply it to other programs across London. What we often see is that there's really good local improvement effort, but that scaling that to a large population size is very difficult. And so the test for this project for the London data strategy is its scalability, which is why it's so important that you're working not just in East London, but with South East London and North West London as well, because actually the context of different environments and systems changes quite a bit, and getting things to work across multiple systems is quite difficult. And that's the real test. The 3 other programs are for cardiovascular disease, for asthma, and the cardiovascular disease one is led through South East London, the asthma one is led through North West London, and for cancer, for some pathways in cancer, led out of the Royal Free in North Central London with Barts Health. And so it's how we use data at scale to drive improvement is a really important question. And through the pandemic, of course, the value of data has been exposed very, very sort of significantly, but also the problems with using that data. And it's not a surprise, therefore, that we're looking at ways, if you've looked at ways that we can decompress the healthcare system, and this is one of those ways, because in all of those areas, there is potential extra load to the system because people who have these diseases or potentially need stopping these diseases progressing could end up in a hospital setting. And so it's really important that we put every effort into this. But there are 4 sort of outcomes we're aiming for, not just the improvement in the healthcare outcome, but to help us with planning going forward, to help us with other research going forward, and to get products out into use. I think there's a whole spectrum of work that we need to be able to support safely through this work. Next slide. So why did we choose this program in particular? I think the panel that reviewed it felt it had a very clear and actionable healthcare improvement objective. It had a clear view of how to use data. And what we see occasionally is that people are good at one or the other of those 2 elements. They're good at using data to come up with an answer, but not good at how you use that data then to drive the improvement, or they're good at driving the improvement but haven't got the data. And so it's both of those that are really critical. It was also felt it would make a difference to patients in real life. We know the significance of the illnesses that not being vaccinated can cause. And so it's really critical that we help to prevent that. And we've heard this afternoon of the low uptake across London and what we need to do about that. It has strong support across London, across academic and NHS. And it looks like in these sort of things, it's quite quick to make a difference. If half the practices have now downloaded that, then we could start to look to an improvement in the near future, and it would be good to see that happening. One of the things we've got to think about when we design these programs, and particularly data systems that clinicians use, is how it's easy to do the right thing. And it was good to hear Jagan speak about how those tools can help in those discussions with patients, as well as help them in planning what to do as a practice level. And I think that's really valuable. It's one of the pitfalls that we often put systems in that are hard to use, and it's sort of quite hard to work out how to use it properly. So really, we're trying to build a system across London that can change the behaviour of the people in the London system, professionals, managers and others, in how we use data. And we hope that these 4 projects will lead us to a longer term programme over the next few years, where we continue to invest in schemes like this, addressing difficult issues across London. So I commend this work to you. It's very valuable for us in the wider London region, and I repeat my offer to you, as I do, I hope, on a number of occasions, that if you want any further help or support in this work, then let's further discuss this and see what we can do to help you make this a success. But to everyone, thank you very much.
Thanks so much, Luke. So that, I think, really sums up the presentations that you've heard. That this is a system. It's not a plug-in, and it depends upon policy and strategic engagement by commissioners with the necessary incentives to make sure that practices have the necessary resources to do this, to have digital enablement that helps people work smarter and not simply harder, and that, you know, above all, that we have clinical engagement of practice teams, and that's an engagement, you know, from the receptionists to you know, partners and everybody in between. You know, it's very often practices are complex beasts that we need to engage all people in that. So we've got a few minutes now for questions. I'd be grateful if you could put them in the chat so that we can have a look at those. Anna, have we got anything already that we want to address particularly?
Hi, John. Yes, we've got Mark from Spring Hill who asked, how do we get those tools? He asked this question while Carol was talking. So as I put in the chat, the templates have already been distributed. Every single practice in North East London has them. The tool has been launched. It's been out now for 4 weeks, and I put a link on the chat to request the download if you haven't done it yet. Oh yes, sorry. And the maps and dashboards are still in development.
And outside North East London, are you hanging on for the time being?
Yeah, we need to finish the job in North East London first.
Yeah. Okay, thank you. And any other questions there that we had? I think there was one about the templates you've covered. These are published and available as are the tools.
Yeah, and there's a question about data from Jack Barker, and Carol was liaising with him.
Yeah, so I think, Jack, you were interested in how we produce the monthly data extraction from the Discovery Data Service. This is quite a complicated analysis, and I won't bore everybody here with the kind of technical details, but it involves creating monthly cohorts of children who have turned 18 months in that month in order to construct this metric.
God.
Actually, the metric for the second vaccination immunisation QOF metric V-I-002, and for which there were no national data. And we are in discussion with Shan and Kavita, who are respectively our collaborators in South East and North West London, to develop similar reports out of your region. So we have a baseline and we can begin to understand what the problem is that we're trying to tackle.
I guess the question was sort of a little bit tricky. Do you build it up month by month, or are you able to write the query and ask what was the situation at month end 18 months ago, for instance?
Yes, okay, so perhaps we can take this offline.
It's getting very complicated.
It's getting quite technical, Jack, but I accept your curiosity. It's we have cracked this one. Yeah, thanks.
So two other questions that we've got. Is it available yet for System 1? Anna, do you want to, or Carol?
So we are currently working on a version for System 1. System 1 has some slightly different back end for the searches. And what we're aiming to do is to be able to run, what the practices do is they run a search each week to identify children who are due or overdue that week. And then that gets imported into our active patient link tool. So the active patient link tool is usable in any system, but it's the search that we're writing now for System 1. So at the moment, the launch is for EMIS, but the data entry templates are updated for both System 1 and EMIS practices. And so practices can make a start if they haven't got a data entry template by following the links that Anna has posted in the chat.
We were asked also about a vision, but we, as we say, we don't have a tool for vision practices because they were very small in number, and the problem of constructing these tools is quite substantial. So whether or not we eventually get round to it, I'm not sure. But the first priority is to do EMIS and System 1 as they're the largest numbers. So apologies to Vision. Is the tool embedded already in EMIS? Mira Ranjan asks. Anna?
Mira, I'm not quite sure what you mean. The tool is not embedded. You have to request a download.
Yeah, so it's what it is, Anna, Mira, is that there are two bits to the tool. One is an EMIS search that you run in your practice, and then that search outputs a file which is then imported into an Excel spreadsheet, which is the tool, which has macros that then show you which children are due now and which are overdue and so on. Any other questions people want?
Yes, yes, there is a question from Rihanna from NHS England about accurate denominators. I'm not quite sure whether she refers to data or to call and recall. Our tool will facilitate call and recall for just the patients who are eligible right now and who are currently registered in the practice. So yes, they will have accurate denominators, but accurate registers to call on, eligible registers. In terms of what denominators we use when we come to create dashboards, that is a different matter, and we will have to have discussions across NEL about what kind of denominators you want to use, because it will depend on what age cohort you want to use and whether you incorporate timeliness. Carol?
Yeah, so I just want to say two things. One is, I think that question, Rahana, highlights the importance of a London-wide approach. And in the first instance, the Discovery programme enables us to see where children are if they move within our region, and being able to build a London-wide approach will help us to understand mobility across regions. We are currently providing to NHS London all the data from Discovery to the Child Health Information System hubs. And I think it's very important that we have a single source of curated high quality truth about where we are with immunisations. The denominators are always a challenge. They're a challenge in general practice. And for our analyses, we are looking at patients who are currently registered in the period at risk, if you like, for their immunisation.
A question, yeah, you can feedback any ideas for any other videos. We'd be welcome your comments about, kind of any other tool educational elements to this that might be helpful. Jagan, that's great. Are there any other questions or things that people want to raise at this stage? Carol, is there anything you want to say in summary?
No, I just am incredibly grateful to people for giving up their time to come to this launch. I'm very grateful to our funders and all the people who've really made it happen. And we look forward to reporting to you as we progress over the coming months, both to see how we're making a difference in North East London, but also how we meet Luke's challenge to demonstrate that we can scale both the data model and the clinical effectiveness model to other regions in London. Thanks very much.
Great. Well, thank you, Carol and team CEG, Helen, Kath, Jagan, and Luke. That's really fantastic. I hope that in a few months' time we'll be able to give an update on some degree of progress, Carol, and as you kind of move forwards. And also to hear from the other areas of London as to how they're progressing. But I think the whole thing is off to a fantastic start. And thanks again for everybody for coming. And if you want further information, then our data is on and contact details are on the website. So you can have a conversation via that. So thank you very much indeed. Again, thank you all for coming, and we'll leave it there. Thank you.